Now comes the heftiest part of stops, the infamous part 3.
So what does this part consist of?
This part consists of the treatment protocols for patients allocated to the non-reducible discogenic group, which means that disc pain that doesn't respond positively to mechanical loading strategies. It's okay. And also, this protocol is used to treat patients with lower back pain with radiculopathy. So usually in this group, we'd observe some positive neuroscience.
That sounds so intimidating. How would I manage something like that?
Great point. This one is quite complicated, so let's get straight into the protocols. Here is what session 1 is going to look like. We are going to educate the patient about the healing time frame, as well as some simpler strategies to help manage their posture.
So it'll take you about 6 to 12 weeks to start to heal.
Oh, getting up!
Meanwhile, we can cue your spine in neutral position with some tape and a lumbar roll. So make sure you have regular movement breaks, so maybe every 5 to 10 minutes go out for a walk. We're going to use this to help settle down some of that inflammation.
And finally, we're going to encourage the patient to manage their condition themselves and also prescribe them a gentle walking program.
Remember that massage sessions and other active therapy isn't going to help as much as exercising, so this is all in your hands to make sure you get better. We'd just like you to come on gentle walks up to the point where you feel pain and try and prolong that to 30 minutes.
This is where the individualized physiotherapy comes in. As you'll see later in part 5, posture education can potentially exacerbate some psychosocial factors that's going to exacerbate the patient's symptoms. Furthermore, you'll notice a lack of manual therapy. Like this student here have said, manual therapy is going to induce a quick fix kind of mentality in the patient, which isn't going to help with the long-term prognosis.
Wow, very nice.
Here's what session 2 to 10 are going to look like. We're going to reinforce our education as well as provide some additional posture and pacing strategies.
Continue doing your movement breaks, be aware of your posture, and don't do things too fast.
Then we're going to introduce smart goal setting goals that are relevant to the patient. And also, during session 2 to 10, if the patient does complain of the pain getting worse, then we're going to do detailed questioning to see if we can find the cause of this exacerbation. If not, we'll provide brief encouragement and then move on. And then we're going to commence the motor control training.
Ah, this is where the motor control training we learned at uni comes in.
Correct. Because this is quite well taught in uni, I'm only going to briefly go through this so it doesn't occupy too much of your little attention spans.
Find your ASIS and then just go in immediately just a little bit and then instruct the patients to contract the muscle under your finger and draw it closer to your spine. Will, can you gently contract the muscle under my finger and just imagine pulling it to your spine?
Keep in mind this treatment is used for other groups of stops, just at different stages of their management plan.
And that's it. That's part 3 of the stops done.